common cold, which is called a flu or influenza infection. One of the things for our listeners or for our followers is that influenza virus, there are many of them, and influenza virus is also where the coronavirus is. Because all of them actually they're called coronavirus, and they normally cause infection mainly in the lungs, in the nose, and in the sinuses. That's where the infection mainly are, and that's why we find that when people had coronavirus infections, apart from difficulty in breathing, there's other issues, but mainly this effect of coronavirus is mainly in the lungs, in the respiratory system, and that's why influenza virus nowadays are very common, and that's why we will have so many common colds. And you have cough, and common cold just have cough, you have sneezing, you have change of your voice, and you have headache, which is quite intense sometimes. And sometimes for the common cold, unless you have a cough and cough which is productive, we don't give you antibiotics. But when you've got common cold and you've got cough which is productive, we need to go ahead and be able to give you antibiotics, because you can have a common cold which progresses to pneumonia. And that's why sometimes you find that common cold cures by itself 7 days, either with treatment or without treatment, because your immunity picks it up. Now, what you need to do for the common cold is that, and even during this time, to prevent yourself common cold, is just take a lot of fruits, a lot of vegetables, and a lot of fish oils. Because when you've got vitamin B, you've got omega-3, and you've got omega-3, and you've got also vitamin B, and the common cold becomes very minor. It gets you, but it does not bring you down. But when those are lacking, it normally breaks you down. Remember, when you're common cold once, you don't get it again this year, because you develop immunity against that virus which is circulating now, and the virus becomes very common this time and this time, and that's why you normally advise people this time. Of course, we know there's a vaccination for influenza, but normally every year there's a different strain of influenza. The way we had issues of corona, there was this strain of corona, another one came. The same thing with influenza viruses, because they are in the same class, there's the same genome. And that's why this time of the year, and it's every year, we've got pneumonia, we've got influenza infection, common cold, and that's how we go about it. Apart from those few diseases we have talked about, we have got also measles, which become very common this time, and most of measles progresses into pneumonia. And that's why and measles is common in children before age of 12 years. Remember, measles is vaccinated. And even those who are vaccinated, they can also develop measles. We don't know what happens, so that people develop measles and they're also vaccinated, but measles become common in this area. And it's all over Kenya. So it's very important to make sure that at least you check your children when the measles have got rash, and after rash they have a cough which is dry. Sometimes they start producing sputum. But when a child produces sputum because of measles, it needs to be taken to us, because the measles can be super infection to pneumonia, and that becomes very serious. And that's why most of the children die because of pneumonia, because they had measles which progress into pneumonia.